Trustees, scholars, alumni, members of the class of 2026, it's so wonderful to see you here breaking bread together and stepping into this experience as a Morehead-Cain scholar so fully. I was struck that today really represented, for many of you, the start of a college experience. You had your first class meeting. You had the opportunity to work together in Outward Bound. You had the opportunity to imagine yourself here as a scholar. Tomorrow, many of you, some of you on Friday or on Tuesday, but tomorrow you will have your first advising appointment. And it's so exciting to me to see you have the chance to step so fully into imagining life in university and how you will make the most of it over the course of the next couple of days, but also to see you forming bonds that will last a lifetime. I'm particularly excited this evening, not only because Madhu, our speaker, is so extraordinary, but also because we are witnessing the power of the Morehead-Cain network, the sense of connection that our alumni feel, and the shared values that permeate all in this community, with a special guest who has chosen to join us. Governor Roy Cooper of the state of North Carolina is a Morehead-Cain from the class of 1979. He just shared with us at our table that that was the first class at Morehead-Cain that included women. And so he is part of actually one of the landmark classes of this community. Today, he is a second-term governor of the state of North Carolina. And he chose to join us here because he's so excited to welcome the class of 2026. But he also chose to join us here because he has the opportunity to introduce a younger alumnus from our class of 2014 who is doing important work in service of this state and in this time during this pandemic is particularly important for the people of this state. It's not often in my life that I've had the opportunity to invite someone of such stature to an event and have them come not to give the keynote, but to make an introduction. And for that, Governor Cooper, we say thank you. Welcome back to your alma mater. Welcome back to Morehead-Cain. It is like Hotel California. You may enter, class of 2026, but you will never leave. Have a wonderful evening, Governor Cooper. Please come and join.
All right, guys, it's not just the tie. So first, did we crash the party at Cameron Indoor Stadium last night or what? I'm Roy Cooper, and I'm a Tar Heel. Chris, thank you for the introduction. Very grateful. We are ecstatic to have you as president of Morehead-Cain Foundation and are excited as to what your tenure will bring. And I just can't tell you what it means to me to see these bright young faces out here, the future of our great university, the future of our foundation, future of our world. So my claim to fame is not being governor. Who in here has heard of Phil Ford? Okay. Phil Ford is the greatest point guard in UNC basketball history, okay? Now, some people can dispute that with Kenny the Jet and all of that, but I'll tell them each one that Phil Ford is the best. And he graduated a year ahead of me, but we played at rival high schools. And I played for Northern Nash, he played for Rocky Mount. My claim to fame is that one Friday night in the Rocky Mount High School gym, I, Roy Cooper, blocked Phil Ford's shot. He got 52 points that night, but by God, he did not get 54. I know he really doesn't remember it, but today he really does. He says he does anyway, as he was out helping me get elected governor and telling the story about how I blocked his shot. It was just a wonderful, wonderful thing. But I do want to congratulate all of you for being offered the Morehead-Cain Scholarship, the second best thing that has happened in your academic career. The best thing to happen is when you accept it. I know from personal experience what the Morehead-Cain Scholarship gives to you. Instant credibility when you walk in. Not only do they know you are smart, they know you are a leader. It gives you studies and a degree from the greatest public university in the country. It gives you no student debt. No small thing. No small thing this day and time. But maybe most importantly, and Chris alluded to this a minute ago, it gives you a network of friends and people you don't even know yet with whom you will have a special bond. A bond of love for this great university, this Morehead-Cain Foundation, and a love for making things happen in this world. This bond is with scholars who are now all over the country and all over the world, in classes that came before you and in classes that will come after you. They are business and government leaders, healthcare professionals, academicians, researchers, nonprofit leaders, attorneys, writers, performers, and so much more. They are tackling some of our greatest challenges, some on a wide scale, some person by person. They're tackling the challenges of climate change, affordable housing, genetic diseases, lack of quality education, and yes, the challenges of intolerance, discrimination, and divisiveness. They are solving problems and opening doors. They are opening doors one by one, and they will help open doors for you when you accept this scholarship. Now, take my good friend Tim Sullivan sitting over there on our great board at Board of Trustees at Morehead-Cain. Tim's class of '85. He invited me to come tonight, called and said, you really need to come talk to this class of scholars. We need them all to come. We didn't even meet while we were at Chapel Hill. I was 6 years earlier than Tim. But we are part of this bond. Tim has been president and CEO of Ancestry.com. He has been a brilliant entrepreneur and man who cares about people. He's also encouraged and supported me and has been a place of ideas and has helped me every step of the way. I get so much from Tim. Tim gets from me my $39.99 monthly fee to Ancestry.com to discover my roots. He also gets good government, I hope, and certainly my friendship. But what's really great tonight, and I would love to talk to you all night because there's a lot to talk about, but I get to introduce the keynote speaker who's a coworker of mine. She is a 2014 Morehead-Cain Scholar, Phi Beta Kappa here, Golden Fleece, leader on campus. Then she got her master's in public policies from Duke, where she was a Margolis Scholar. And, you know, one of my goals as governor has been to attract the very best, brightest, and most diverse cabinet and government staff in the history of our state. And we have done it. We've exceeded the goals, and it's working pretty well. Your keynote speaker tonight is a shining example of that. We've attracted a lot of other Morehead-Cain scholars to work in state government as well, but she's pretty special. She joined our department of North Carolina Department of Health and Human Services in 2018, where she was a senior strategy advisor on Medicaid. And there she worked with the Eastern Band of the Cherokee Indians in North Carolina on the first Indian managed care entity in the nation. And then she also co-led the successful application for the NC Integrated Care for Kids. She then was promoted to Chief of Staff to the Chief Deputy Secretary of the Department, Susan Gale Perry. And on the very next day, in March of 2020, I signed an executive order declaring a state of emergency on COVID-19. Welcome to state government. Susan Gale Perry said about your keynote speaker, she's the kind of person you want on your team when you're facing what it seems like insurmountable odds. She found herself working at the Emergency Operations Center almost from day one. She built programs and processes and relationships from the ground up in a matter of weeks. And she did it with smarts, grace, humility, and hope, even in the hardest moments. There are a lot of people who said a lot of other good things about your speaker tonight, including Dr. Charlene Wong, who is a great Morehead-Cain scholar and is doing such great work at the Department of Health and Human Services. But now your speaker is the Deputy Director of a new division that I just established through executive order, the Division of Child and Family Well-Being. We know that this pandemic has put a spotlight on challenges we knew already were there, but it's given us an opportunity. I'm a Presbyterian. You got to find good things out of bad things happening. And now we've got the investments where we're going to connect high-speed internet access all over this state. And we've been able to identify injustices and inequities in the system that we are ready to tackle. But this new division in the Department of Health and Human Services has seen that so many people and families, particularly with children, have had to go to agency to agency to agency to agency to try to pick out help and services that they need. This division is going to wrap all those services around the families and the children. That's going to be exciting, and she's going to be one of our great leaders in helping to move our state forward. Let me introduce to you a great Morehead-Cain scholar and a real leader in North Carolina, Madhu Vulimiri. Come on up, Madhu.
Thank you so much, Governor Cooper. It is such an honor to have been introduced by you and in such a kind way. And I'm incredibly honored to be here tonight. So good evening to Morehead-Cain staff, scholars, alumni, and the incoming class of 2026, I want to begin by offering you my most heartfelt congratulations to every single one of you receiving the Morehead-Cain Scholarship. I also want to thank Chris Bradford for asking me to speak tonight. It's just an incredible honor to share the room with all of you tonight. So, we often say around here that it's a great day to be a Tar Heel. And that's true every day, but especially true after last night. How about those heels? So, on this happy occasion, I want to speak to you about what the Morehead-Cain Scholarship has meant to me and how it's helped me find my sense of purpose and to see it through. So, as I look across this room at each and every one of you, I see an exceptional group of leaders. I know this firsthand because I had the privilege of getting to serve on the selection committee this year. I got to read many of your applications, had conversations with many of you, and what I learned from that is no surprise, you care deeply about the complex and thorny problems of our time: hunger, poverty, racial injustice, health and educational inequities, and you want to make a difference in the health and well-being of our communities. And you've already risen to immense challenges. And so when I look out into this room and see each of you, I feel hope, and I feel excited. I feel excited to see what all of you will do here with this scholarship at this university for our state and for our world. There's no one path to being a Morehead-Cain Scholar. There are so many things that need to be done in this world, and it's not always clear what our role is in the grand scheme of things. So in my first steps of my journey, I found that sometimes you have to go looking for that purpose, but there are other times where it comes looking for you. And tonight, I want to tell you a little bit about my path. So a few years ago, as Governor Cooper alluded to, I was at a transition point in my life, much as you are right now. After graduating with my master's in public policy, I knew that I wanted to make a positive impact on the health and well-being of people, but I didn't know exactly where and how. And after a lot of reflection, I decided that the best place to do that, to find my purpose, was at the North Carolina Department of Health and Human Services, the state agency that is responsible for ensuring the health, safety, and well-being of all North Carolinians. They call this kind of work public service, and that's one of those phrases that gets thrown around so much that it almost starts to lose its meaning. But in my work at the North Carolina Department of Health and Human Services, at the Medicaid agency, I was reminded of exactly why it's called public service. I was part of a team that provides health insurance to 1 in 5 North Carolinians, to children, to pregnant women, to the elderly, and to people with disabilities. I went looking for purpose at Medicaid, and I found it, serving some of the most vulnerable folks in our state. But sometimes purpose comes and finds you, and sometimes you get a call. And in February of 2020, I was asked to serve as Chief of Staff and Senior Advisor to Susan Gale Perry, as you heard from Governor Cooper, who was the second in charge at our department. And I was supposed to start this job on Monday, March 16th, 2020. But on Saturday, March 14th, I was sitting in my living room and actually getting ready to go to one of my best friend from Carolina's wedding that evening. And I literally got the phone call from Susan, and she said, "I know your first day is not till Monday, but you might have heard that there is this escalating situation called COVID, and we really, really could use your help, especially because Governor Cooper is about to announce that schools are going to be closed for 2 weeks." 2 weeks. Can you be at the Emergency Operating Center by noon? And of course, I answered the call. And for the next 18 months, I was part of a team at the Department of Health and Human Services that was charged with supporting our children and families during this pandemic, ensuring safe and affordable childcare, providing meals to kids when our schools were closed. As we know, so many kids depend on our school meals. Planning for safe school reopening in the fall, and supporting an equitable distribution of COVID-19 vaccines in our state. Working on the COVID response was the most challenging work that I have ever done. Our team made decisions that impacted millions of lives. We had to make those decisions swiftly, but also thoughtfully. And I don't want to sugarcoat anything. There were times when I didn't know if I was capable of doing what was needed. There were times when I didn't know if I could keep going. Our team, the governor's team, our colleagues at the Department of Public Safety, so many government employees, so many partners across the state, we pushed ourselves to the limits because we had to, because the people of North Carolina were depending on us. And looking back, that is a big part of why I'm so proud of this work and why I feel so lucky to have had the opportunity to serve. And what I learned from this experience, and someday you will find too, that sometimes you will be asked to answer the call, to step up and do things that you never imagined that you could do. But you can, because everything that you've done has brought you to that moment, and you have a community around you that'll be with you every step of the way. So it has truly been the greatest honor of my career to serve under Governor Cooper's leadership and our former Secretary, Mandy Cohen. During this time, our state is so lucky to have Governor Cooper at the helm of our state during this crisis. And as you heard, I recently transitioned to a new role as the Deputy Director for this new division of Child and Family Wellbeing, where we're focused on trying to help kids and families recover from this pandemic. We're really focused on a couple of areas in particular that we know have exacerbated during this pandemic. One of those is around food insecurity and hunger and making sure that no child goes hungry. Another is around the rising mental health concerns that we're seeing in schools that are escalating and must be addressed. So in the time that I have left, I want to give you a little bit of a better sense of how I got here and how the Morehead-Cain Scholarship played such a vital role in that journey for me. So I want to let you in on a little secret that it's really easy to make your life story add up really nicely when you have the benefit of hindsight to say, here was my path and here's how it all connected and led to each other. But it doesn't always feel like that when you're in the middle of it. You have moments of doubt, moments where you're asking yourself, am I going in the right direction? But all of that is part of the journey. So I came to Carolina thinking that I wanted to be a doctor, which I surmise that may be an interest of several folks in the audience. And over the course of my time here, I realized that I wanted to improve the health and well-being of communities, but in a different way than pursuing medicine. Instead, I was really interested in this idea of public health and public policy. And a big part of coming to that realization was the Gillings School of Global Public Health here at Carolina. And it's such a testament to this university that I came for a world-class education in one field, and I could pivot to a world-class education in another field. And when I made that pivot, the Morehead-Cain Scholarship gave me the opportunity to explore this newfound passion with on-the-ground summer internships. I still draw on my experiences from the summer after my sophomore year, where I had the privilege of working with Dr. David Ballard, who is another Morehead-Cain alum. I had the opportunity to do public health research around community health workers who played an incredibly important role in helping their patients manage diabetes. That work, that research affirmed that this was the kind of work that I wanted to do, to help inform how to ensure that folks could have access to high-quality health care. And that work has actually really come full circle during the COVID pandemic, where we have expanded the number of community health workers who are delivering critical services to folks, ranging from food and medication and vaccines across this whole state. So Carolina is a place where you can really, really find yourself, and the Morehead-Cain will give you the resources to do that. But I really can't emphasize enough that the Morehead-Cain Scholarship is so much more than that. It's not easily quantifiable. It's an opportunity to become part of a community of scholars, staff, and alumni who will be here for you, not just during the 4 years that you're at Carolina, but in the time to come for the rest of your life. The people that you meet here today, during this weekend, and the Morehead-Cain community that you haven't met yet will become a support network for you in the years to come. I experienced this firsthand when I was in grad school at the other school down the road. I was introduced to Dr. Charlene Wong, and it was actually because my advisor found out that I was a Morehead-Cain alum, and he put the dots. He was like, "You gotta meet Charlene Wong, who is also a Morehead-Cain." She's a pediatrician and a health services researcher at Duke, and at the time, in 2017, she immediately agreed to be my thesis advisor in grad school, and I've been really fortunate to get to continue to work with and learn from her over the past several years in my career in state government, working on the COVID response to launching this new division of child and family well-being. So for me, coming to Carolina meant that I got to be part of this community of peers from all over the world, from Wilkes County, North Carolina, to Kampala, Uganda. Coming to Carolina also meant that I got to learn from some of the most brilliant professors who not only exposed me to new ideas and ways of thinking and perspectives, but also took the time to invest in me, to get to know me, to guide me while I was trying to figure out where I was going to work after college, but even since have stayed in touch with them, and they're folks who really, really care about their students' well-being and are there to cheer you on every step of the way. Being a Morehead-Cain means being part of a community of people who have the talent to make the world a better place and just the right balance of drive and humility to see that work through. It's a community of people who will support you, who will challenge you, who will celebrate your wins, and who will be there for you during the harder times. And there will be harder times. So tonight, I could not be more thrilled for all of you, because I remember what it was like to be in your shoes. I'll never forget my Morehead-Cain finals weekend experience, not in the least of which, because that is where 12 years ago, I met my future husband, Alex, who's here with me tonight. Going into that weekend, I had a friend named Jacob who told me, be on the lookout for my friend, Alex, who's also a Morehead-Cain finalist. And one of our first events of the weekend was, as y'all have probably experienced already, a campus tour. And they told us to meet in the parking lot. And I was waiting there, waiting for folks to gather for the tour. And someone came up to me and said, "Are you Madhu?" Jacob told us that we should meet up. And in my head, I had been picturing Alex as a girl. So the first words that I said to Alex were, "Oh, you're a guy." And the rest is history. So with that, I just want to congratulate you all for this incredible milestone. You are surrounded by a community of folks who are here to support you every step of the way. And I am so happy to see y'all go on this journey. You will not regret it. I am just thrilled for you all to take this opportunity and to see what you'll do with it. So with that, congratulations to the incoming class of 2026. That's a great question. Did everybody hear it? I think I heard you say, what has it been like to be a leader who is a person of color and a woman in this industry? And I'll say that I have actually, at the Department of Health and Human Services, we have an incredibly strong team of female leaders who I've been really, really fortunate to get to learn from and to be mentored by. And I would say, there are things about being a woman, being a female person of color, that there are moments that you find yourself in spaces where you may not be, you may be one of the only people who look like you. And that can be really stressful and scary at times. And I think that being part of a community like this that has really helped to nurture my confidence and to remind me that I am such an important contributor to the team has been such a gift in my career, because there are times where I think regardless of who you are, you go through bouts of imposter syndrome and feeling this question of, how did I get here? Who believed in me? And the answer is everybody around you in this room believed in you. And it is just an honor to get to work in the area of public service, and really hope that many of you will consider at some point in your career doing so. Thank you. Hardest part of being a Morehead-Cain scholar. Well, first I'll say, you're all gonna have to make your own mistakes, but I will be happy to impart whatever wisdom I can at this juncture. I think that Carolina is a place where people are united by this desire to do good and to make a difference. And I think one of the harder parts of being a Morehead-Cain is the feeling of we've been given so much, and having the right way to give back and to demonstrate that we've really earned this, and that we can make a difference. I think there can be pressure at times to do 18 hours of course load when really you should probably be doing a little bit less, and finding that balance. But I would say, Carolina is the kind of place where you want to take advantage of every opportunity that comes to you. And at the same time, it's about finding that balance, and finding the things that will support your different sides of your brain, the creative side, the analytical side, the interpersonal side. And so I would just say that, at times it can feel like there's so much to do here and you want to do it all. It's a huge place, but it's also one that you can make small by finding your community and your peer group. So take advantage of it, but recognize that there is nothing wrong with finding balance in your time here, because you're not going to be able to do it all. So find what you love, be open to exploring new ideas, and run with it.
Thank you so much for your talk. I really, really enjoyed it. My question is more of a strategic one, which is, if your budget were to triple tomorrow, what would be your framework in reallocating it, and what do you think that impact would be?
Wow. Excellent question. So there's a saying that budget is policy, and I think Governor Cooper knows this very well. And your budget reflects what is important to you. And I would say, with my vantage point of thinking about children and families, there's so much more that we need to do to invest in upstream efforts. We have so much money that goes into our healthcare system at a point where folks are often in crisis, and there's just a lot more that we could be doing in the prevention space. And that means investing in people infrastructure to support our families. We know that it's really hard to navigate the healthcare system, for example, or any number of government programs that have a lot of benefits but can be complex to navigate. And so finding ways to invest in both the people and, I would say, our technology to make it easier for children and families to access services that they may need, reducing barriers to transportation, to language access, finding ways to really meet people where they are. And that takes investment. That takes resources, where we need more of. And kids are an area that have traditionally been underinvested, because in the healthcare side, kids are usually pretty healthy, and we spend a lot of our money in managing expensive chronic disease, but there's such an importance to putting more money up front to prevent issues down the road. Thanks.
Hi, thank you so much for coming out and definitely saying a lot of great things to us for this evening. I wanted to focus on how North Carolina is one of the top states in the country when it comes to hog farms and CAFOs, and specifically environmental racism, and how it impacts low-income communities and marginalized communities right next to these critical hog farms and CAFO systems. I'm wondering if you have done any public health concentrated research programs or anything related to that, and you can speak on.
That's a great question. I have not specifically focused on the areas of environmental health and environmental racism that you're talking about. More of my research has been around food insecurity and nutrition and chronic disease management, for example. But I will say what we know is that there are systemic issues that overlap. It's not that people experience hunger or poverty or environmental injustice and racism in silos. These are interconnected systems that really will take a very intentional approach by government leaders, by our philanthropic and private sector leaders to work together to figure out where there are opportunities to maximize our investments when we're trying to help folks access nutrition benefits, for example. How do we also make sure that the work that we're doing is done in an environmentally appropriate way? They're really interconnected, as we know that food deserts are areas that don't have enough investment, don't have enough healthy food options. So I haven't done specific environmental health research, but I think I would just say we know that these issues are so intertwined, and that's why it's really important that we look at issues in a really interdisciplinary way. So public health can't be alone trying to solve the problem. We've got to be at the table with our peers who are in medicine and in law and in education and in organizing. We have to all be at the table because we bring our different perspectives on how to tackle these really, really complex problems that are long overdue to address. Thanks for that question.
Hi, thank you so much for coming out. So my question is, so I know you talked about, thinking about going into college thinking that you're going to be a doctor, kind of finding public health along the way. So how do you, or what was your journey within having trajectory and direction in your collegiate life while also keeping yourself open for new opportunity and new interests?
Yeah, that's a great question. I had been kind of exposed to the idea of public health in high school, late in high school, and coming to Carolina was in part because of not only the Morehead-Cain scholarship, but the fact that Gillings is the best public health school in the country. And I would say I had a rough outline and sense of the area that I wanted to go, in that I knew that I wanted to do something that would improve the health and well-being of folks in North Carolina, but I didn't exactly know how I would get there. And for me, my Morehead-Cain summers really played an important role in kind of narrowing that a little bit more. So I spent one of my summers in Nicaragua, where I was with 3 other Morehead-Cain scholars after my first year, and we worked at a public health clinic in a small town in rural Nicaragua, and really did a diabetes campaign where we went house to house and talked to folks about diabetes and what it was and the importance of going to a clinic to get checked out. My summer after sophomore year was what I alluded to, working in Dallas at a healthcare system, where I got to do this research on community health workers and try to figure out how they helped make this impact on their patients' lives. And then my third summer was in Washington, D.C., where I worked at a policy consulting firm that was really focused on how we implement policies at the state and federal level to reduce childhood obesity. So getting to see different sides of an issue that I cared really deeply about within public health, which was really in the space of access to healthy food, which we know is connected to preventing obesity and chronic disease, which we know is connected to equity and folks having equitable health outcomes. Getting to have those different summers really helped me figure out, for example, that global health, I decided, was not the route I wanted to take. I just realized, being in Nicaragua, that while there were really pressing problems to solve across the world, that I felt like I could make more of my impact in my home state, in North Carolina. Working in Dallas helped me see that I didn't necessarily want to be a medical professional, but I did want to stay in the field of research and policy. So the summer experiences that you'll have will really help you kind of further refine ideas that you might have, but also, I think, allow you to explore ideas that you never thought were possible.
Hi, thank you so much for your time today. I really appreciate it. I would like to know, now that you have the benefit of having completed your Carolina experience and moved on to living in a world as an alum, what would you say to yourself who was a senior in high school, standing on the verge of choosing this scholarship and starting this adventure?
Well, number one, you should absolutely do it. It will be the best decision of your life. All I can say to you is, very honestly, that it changed my life. And not just because I met my husband, and I'm not saying that that will happen to you, but I am confident that you will meet some of the best friends that you will ever have here at this weekend. It changed my life in so many ways, in that it opened the possibilities of what I could do. It gave me the support and the resources to actually go and do those things, and to try and realize that I did want to do some things and didn't want to do others. And I can't really emphasize the community part of this enough, because this is a real group of people who are wanting to make a difference in the world, and they're doing it. And they're doing it in a way that is so thoughtful. And being part of that is like nothing else. All I can say is that I hope that it changes your life too, because it certainly did for me.
Hello, I'm Haley, and I just want to say, first off, thank you for the work that you did during the COVID-19 pandemic. You're just amazing and inspiration. So in your work, you're taking care of the families and children of all North Carolina. How do you keep the humanity side of it and looking at families and children on the individual level? Specifically, there is a cultural divide
Thank you for that excellent question. You're right that there is mistrust in the medical community, in the medical system, among minority populations for really good reason. There has been decades, centuries of systemic oppression and denying of services to people of color, to Black Americans, to Hispanic Americans, to Native Americans. And so it requires extremely intentional efforts to overcome the history that we have in our country with medical racism and these injustices. And so some of the work that I actually did during the pandemic was after our vaccines started rolling out in December of 2020, we quickly realized that we were having gaps in our vaccine distribution by race and ethnicity, and that we needed to make some intentional investments in our workforce to ensure that we could roll out the COVID vaccine to all communities across North Carolina, but in particular with a focus on our historically marginalized populations. And so we stood up an initiative called Healthier Together, which involved really leveraging the expertise of our community-based organizations who are trusted in their communities and who have the lived experience to really help us at government, who have a lot of financial resources to bear, to help better deploy those resources in a really targeted and strategic way. And so what we did was we partnered with an organization called NC Counts that was focused on making sure during the census that every North Carolinian could be counted, because we know that that drives so much of how federal and state investments come to the state. And really invested in hiring a team of folks, of regional directors and managers who were focused on building relationships with churches, with barbershops, with schools, with childcare facilities, to make sure we could spread the word and to really have those one-on-one conversations about the COVID vaccine, which, as we all know, there has been a lot of misinformation and a lot of historical mistrust around the healthcare system. And having that kind of investment in people on the ground with lived experience, with relationships across the state, was such an important part of us being able to focus our efforts in making sure that we were equitably vaccinating for Black North Carolinians, Hispanic and Latinx North Carolinians, and American Indian, Native American folks. So I say that as an example. There's so much more that we need to do. I'm really, really proud of our department because we just recently brought on our first ever Chief Health Equity Officer. It's a man named Victor Armstrong, who I know is going to just do incredible work in helping us both at the department think about how we embed equity into our everyday operations, but also in influencing our state and how we build the pipeline of folks that come from diverse backgrounds into the work that we do, and how we retain employees and retain some of the best talent across the state. So I think that was a long answer to try to get at, this is a really multifaceted issue that I think has to be at the core of the work that we do every day, whether you work in healthcare or not, the work to embed equity throughout everything we do and not have it be an afterthought or a side project, but really be at the core of the work we do. That's the challenge ahead of us, to be leaders who do that. Thanks for the great question.
I think we have two more questions ready, if you're okay. You're ready, two more?
Hi, thank you so much for coming out and speaking today. I think it's really inspirational to see South Asian people of color in such prolific public positions. I think I've never seen that in my experience, and it just makes my heart warm.
Great question, and there were many. I would say one of the biggest challenges in being part of the COVID response was the sheer number of decisions that our leadership team, Secretary Mandy Cohen, Governor Cooper, were having to make about issues that really had no clear answer and no easy answer. And the choices we were faced with, they had immense trade-offs. And you know, in thinking about school reopening, for example, which has been one of the most challenging areas that I ever worked on, in really trying to figure out how do we balance the public health safety of our students and staff and teachers with the fact that we know that schools provide such immense benefits to kids, from school breakfast and lunch, which so many students rely on, to the social and emotional support of being in school and being with your friends and being in a supportive environment, to, in fact, knowing that during the pandemic, we actually saw our reports of child abuse and neglect go down. That wasn't because they were actually going down, but that's because teachers are some of our primary reporters of child abuse and neglect. So we knew that schools were just such an area of immense support to kids, and how we tried to balance the public health with the educational outcomes and the social and emotional well-being was an incredibly hard needle to thread. And I want to give incredible kudos to Governor Cooper for your leadership through this very, very challenging issue of how we make sure that our kids could be safe, but also still learning and accessing all these supports. So that is an example, I will say, of one of the more challenging areas that I was part of a team that was really trying to use as much data and evidence as we possibly could to make informed decisions at a time when we really were grappling with uncharted territory and trying to make the best decisions we possibly could, and give people the time to plan, give our partners in the educational sector, give families time to prepare. So there were a lot of other areas. I think one thing I'll just say about being in government is there's a really high level of public scrutiny around the work that you're doing. And it can, at times, feel, in some ways, you know, you wonder if it goes back to what I said. You have those moments of doubt, but I know how much folks across the state have recognize the important work of our department, and I'm really, really grateful to have gotten to learn and be in the room and hear how decision makers like Governor Cooper and our former Secretary Mandy Cohen made these hard decisions following their values. And in times when there's no clear answer, that's really what needs to guide you. Thank you for that question. Thanks for that question. And, you know, I've talked about schools a lot because I think we know that is an area that is already built in as an opportunity to support kids and youth. So school mental health is definitely an area that we're going to be initially focused on what we can do, working really collaboratively with our partners at the Department of Public Instruction to make it easier for kids in schools to access mental health services, to counselors, to psychologists. As you may know, North Carolina, like many other states, does not have nearly enough of the support professionals that we need to address the even higher prevalence of mental health issues among young people. So back to the question about budget, that is an area where I would love to see us invest more in our professionals who are supporting kids day in and day out. Another area that we are really interested in focusing in on is the data side, because we do have a lot of different data that lives in a lot of different places, and we're really interested in making a child behavioral health dashboard that will bring all of that together so that we really can be very focused in looking at data not only by geography to see where might we need to focus in the state our resources, but also I think back to some of the questions around equity, we have learned during this pandemic that it is so important to be able to break down data by race and ethnicity, for example, to really understand how are we doing on different issues, whether it's vaccination rates, whether it's mental health issues among our kids, whether it's food insecurity. Having that data is incredibly powerful because it helps us then shape how we want to focus our efforts, whether it's really getting as focused as, one county or one area in North Carolina, or working with partners in one specific demographic group. So I would say those are a couple of the big areas where we're early on focused on trying to move the needle on child behavioral health. Thank you all. Thank you so much.